Hi guys, my name's Gabby and my presentation is on cerebral palsy. So what exactly is cerebral palsy? Cerebral palsy, also known as CP, is a permanent disorder that appears during early childhood due to abnormal development or damage to the brain. The areas of the brain that are affected typically control movement, balance, and posture. CP can be very mild in some cases, for example, causing one to walk with a limp, or it can be very severe, causing paralysis of the limbs. Those diagnosed with cerebral palsy typically demonstrate stiff or weak muscles, poor coordination, and tremors. They also can experience problems with their sensation, vision, hearing, swallowing, or speaking. So some of the risk factors for CP include being a twin, premature birth, which this accounts for about 40 to 50% of all children diagnosed, infections during pregnancy such as toxoplasmosis, rubella, difficult deliveries, and head trauma are also risk factors for CP. There is some evidence that genetic factors do account for about 2% of cases, but not a lot of information is yet available on that. So there are 4 different types of CP. Spastic cerebral palsy, which is shown as the pink, accounts for about 70 to 80% of all cases of CP. Athetoid, also known as dyskinetic, ataxic, and mixed cases of CP each account for about 10% of cases, so they're not nearly as popular of a diagnosis. Spastic cerebral palsy is the most common type of CP, again at around 70 to 80% of all cases, and is a result of damage to the motor cortex, which is depicted as the red on the brain there. This controls voluntary movements, so often those with spastic CP suffer with stiff muscles in at least one limb or contractures. They also have an abnormal gait if they are able to walk and abnormal reflexes. Athetoid or dyskinetic CP is due to damage of the basal ganglia or cerebellum. The basal ganglia is the purple inside of the brain. Those with this less common type often show hypotonia, which is where muscles are very weak, or hypertonia, which is another word for spasticity, so muscles are very rigid and tight. They also will have involuntary movements of the head, torso, and limbs, floppiness of the limbs, posture problems, feeding issues. Ataxic cerebral palsy is the result of damage to the cerebellum, which is shown in the picture there. This form of CP is characterized by lack of control with voluntary movements, difficulty speaking, problems with depth perception, and knowing where the body is in space. These people tend to have shakiness and tremors as well as an abnormal gait. Some children are diagnosed with mixed CP, meaning that they have more than one specific type, and is a result of multiple areas of the brain undergoing trauma. They can have any number of the characteristics listed in the previous slides, such as hypotonia, involuntary and spastic movements, abnormal gait, and so on. In the previous slides, we saw how cerebral palsy can be classified into 4 different categories. However, more often than not, children also have associated contractures. So these are included in their diagnosis. For example, if a child with spastic CP has contractures in both arms, they are considered to have spastic diplegia cerebral palsy. It's just a way to more accurately define their condition. As you can see, there are many impairments that go along with CP. 1 in 4 are unable to talk, 3 in 4 experience pain, 1 in 2 have an intellectual impairment, and so on. Unfortunately, there are so many complications that are associated with cerebral palsy, and these are just a few of them. So here's just a quick question. What percentage of children do you think with cerebral palsy are able to walk independently? I'll give you a minute just to think about it. So the answer is actually 60%. Most people tend to think that the majority of people diagnosed with CP are wheelchair-bound or require some type of aid to walk, when in reality, more than half are capable of walking with no aid. I actually thought that this was one of the more shocking things that I learned while researching. And 10% only walk with an aid, and 30% do require a wheelchair. So the diagnosis of CP usually occurs around the age of 12 to 24 months. However, doctors are able to determine the severity of their case most accurately around the age of 2. Cerebral palsy is a non-progressive disorder, but this does entail lifelong disabilities. The majority of those affected have a normal life expectancy. However, about 5 to 10% of patients died during childhood. Rehabilitation and orthopedic treatment are absolutely necessary for those suffering with CP. Without it, they will physically deteriorate, so it is extremely important that this is a part of their everyday life. Cerebral palsy actually used to be a contraindication for exercise because experts thought that this increased muscle spasticity. However, this has since been disproven, and it has been proven to help against muscle spasticity. Aside from this, exercise helps as a major combatant against secondary complications such as obesity or diabetes, improves body functions, improves perception of self-worth, and functional competence. There are some difficulties with exercise, as well as including higher energy costs, so they tend to become tired much quicker than regular adults would. Some have a limited range of motion, and they also experience pain. So there is no cure for cerebral palsy. However, interventions such as physical, occupational, and speech therapy can help improve their quality of life and help with environmental adjustments. There are medications that help manage symptoms. A lot of the time, these are muscle relaxers, just to help reduce muscle activation and control spasticity. So for my case study, I chose a 22-year-old male patient diagnosed with spastic cerebral palsy. He experiences tight muscles in his chest and has trouble at his job in a warehouse where he must push and pull boxes for the majority of the day. He wants to also improve his endurance. He also wants to do this over a 12-week time period. To assess my client, I would of course choose exercises that are compatible with his condition and the severity of his cerebral palsy. So since his condition is very mild, I would choose to do a leg, back, and chest dynamometer, the YMCA bike test, which I chose a submaximal test due to his disorder. Since those with CP tend to have a greater cost of energy, I thought a max test would be slightly inappropriate. I also chose a 1RM row and leg press. For some cases of CP, I would have chose a 10RM test instead, but again, since his case is more mild, he should be capable of handling the greater stress. After analyzing his exercise testing, I would prescribe a warm-up of 5 to 10 minutes of walking, jogging, cycling prior to beginning exercise. So for his cardiovascular fitness, this is broken up into 2 6-week time periods. So for the first 6 weeks, I would prescribe 1 to 2 sessions per week at 40 to 50% of his VO2 max. These could be swimming, biking, arm cycling, running, hiking, dancing, any type of activity for about 5 to 10 minutes just to kind of get him acclimated to cardiovascular fitness. And then for the second 6 weeks, I would prescribe 2 to 4 sessions at 50 to 80% of his VO2 max. And then increasing the time to about 10 to 20 minutes. Now, for muscular strength and endurance, this again is broken up into 2 different periods. For the first 2 sessions per week at 10 to 15 repetitions, 60 to 70%. Mostly focusing on back exercises, but full body as well. Now, this is because he did complain of tight muscles in his chest. And one article that I found did state that focusing on strengthening the muscles that oppose the tight muscles is the most effective way to kind of equal the body out. So then for the second 6 weeks, I would prescribe 2 or 3 sessions per week at 6 to 12 repetitions and 70 to 80% of his max, and 8 to 10 exercises per session. Now, for flexibility and balance, since they weren't a goal of the clients, I would prescribe what the average adult should do. So, daily stretching and balance activities for 20 to 30 minutes on things like yoga, tai chi, Pilates, and incorporate some static and dynamic stretching for 20 to 30 minutes per day. So in conclusion, I found this quote that basically sums up exercise and cerebral palsy. I'm not sure who the author was, but it says, an exercise training program improves physical fitness, participation level, and quality of life in children with cerebral palsy when added to standard care. Exercise will benefit someone suffering with cerebral palsy. However, it is most effective when added to their standard care. So here are my references, and thank you all for watching.